Welcome to the press briefing. We have today Dr. Albert Au, Principal Medical and Health Officer of the Center for Health Protection, and Dr. Larry Lee, Chief Manager, Hospital Authority. Dr. Au will now give you an update on cases. Members of the media, members of the public, good afternoon. I would like to report on the number of confirmed cases yesterday. On the 28th of February, the Department of Health has 32,597 confirmed cases. Case number 20577 to 23838. Now, of the 32,559 cases, 3,497 cases confirmed by the hospital authority, 1,274 cases confirmed in public clinics, and 22,896 cases confirmed by the private sector. The total number of confirmed cases stands at 225,746. And then of the the Department of Health conducted DNA sequencing on 1,272 samples. Only one sample tested positive for L452R. That means it's the Delta strain, and so the percentage is 0.08. For 1,857 samples, they test negative to L452R. That means they're mostly Omicron cases, and then for 91 samples, the finding is uncertain. And for 95 samples, there's not enough viral load for sequencing. And then we find yesterday 34 other residential care homes have an outbreak, mostly elderly homes. 25 cases involved elderly homes, and 9 cases involved homes for the disabled. 249 residents and 30 employees are infected. And so far, there are about 615 residential care homes with infected cases involving 3,150 residents and about 900 staff members. And then in February, for the cases we've received, with known addresses, we've done some analysis and statistics, and then Yuen Long has the highest number of cases. That's 12.7% of all the cases with known addresses. And then next is Sha Tin, 11% of cases are in Sha Tin. After that is Sham Shui Po, 8.6%, and then Kwun Tong, 8.5%. Fifth place is Yau Chim Wong, 7.8%. Now, in these districts, they have relatively more cases, but then actually across the territory, we've seen cases in all districts. That's all from me for today. Dr. Lee, please report the situation for Hospital Authority. We have 6,124 confirmed cases and positive cases in North Lantau Hospital, Hong Kong, Infection Control Center, Hospital Authority, Infectious Disease Center, AWE Community Treatment Facility. And then 570 patients are in the Penny's Bay Community Isolation Facility. Last night, we reported 57 patients in critical condition, 88 patients in serious condition. And among the 57 critical patients, 41 have not had any vaccination record. For the 88 patients, 64 have no vaccination records. As at 0 hours today, in the past 24 hours, 117 patients passed away because of COVID-19 infection, 68 males and 49 females, age ranging between 47 and 99. And among the 117 death cases, 63 came from residential care homes. 86 did not have any vaccination record. 15 had 2 doses, 16 had 1 dose, and then 106 of the death cases were elderly persons. For the younger patients, I'd like to say a bit more on them. There's a 59-year-old female patient. She is a disabled person. She had history of cancer On the 27th of February, she went to the Accident and Emergency Department at the Queen Mary Hospital. Her condition was poor. She had pneumonia and fever. She was admitted to the hospital and she passed away on the 28th of February. Then another 58-year-old male. He had no underlying conditions. When he was admitted to hospital, there were obvious signs of pneumonia and pulmonary edema, and then she was admitted to the Queen Elizabeth Hospital on the 27th of February. He passed away on the 28th of February. He didn't have any vaccination record. And then the third death case involved a 47-year-old female. She has an immunity disease. She was admitted to Tin Shui Wai Hospital on the 26th of February. She had myocarditis, and then she was transferred to Moon Hospital, and she passed away yesterday morning. The fourth death case, a 55-year-old male. He had diabetes. He was admitted to the ICU at the Eastern Hospital on the 25th of February, and he passed away on the 28th of February. And then a 57-year-old male, the last case I want to talk about. He has some renal disease. He suffered shortness of breath. He went to the Tin Shui Wai in the department on the 27th of February. He was sent to an isolation ward in Tumen Hospital, and he passed away yesterday. The last one, 57-year-old female. She had a history of cancer. She also suffered shortness of breath. She went to the A&E department at the Prince of Wales Hospital on the 26th of February evening. And then she had blockage in her pulmonary veins, and then she passed away at 1 p.m. on the 20th of February. So these are the 6 death cases involving those who were relatively younger. 2 had underlying conditions. 3 had obvious diagnosis. 1 did not have any chronic disease. Now, because of lagging in statistics, so 55, there were 5 other death cases not announced yet. So far, in the 5th wave, 808 patients passed away in public hospitals. Most of them were the elderly. And then in the past 2 years, 1,013 patients passed away in public hospitals. In the past day, 569 patients recovered and were discharged, and the occupancy rate of our isolation bed is 89%. That's about our upper limit. And then 30 patients were screened in upon admission, and 140 patients in the same ward listed as close contact, and the 3,570 employees confirmed cases. For the North Lantau Hospital, starting from midnight on the 2nd of March, all 160 beds of the hospital will be converted into beds for receiving COVID-19 patients, so we could focus our manpower resources in taking care of patients. In the light of the severe epidemic, A and E departments will continue to operate, but for the North Lantau Hospital, Hong Kong Infection Control Center, Hospital Authority, Infectious Disease Center, AWE Community Treatment Facility, and Penny's Bay Community Isolation Facility. Now, for patients with urgent needs, they will be only patients will be sent here, and other patients will be sent to Princess Margaret Hospital. And then for other patients in other hospitals, they will be transferred to the Princess Margaret hospitals and other hospitals, and the specialist service will remain in place. And then for elderly patients, there will be video conferencing, video remote treatment consultation rather, and then we have revised the route so that there won't be sharing of the same routes in hospitals for A and D patients and other patients. And then we want to make sure that people will stay safe and healthy. Thank you.
We will now take questions. Please raise your hands and use our mic to ask your questions, and please identify your media organization. The lady in the middle. Good afternoon, I'm from Now TV. Today we have a record high number of reported cases again, more than 30,000 cases. When we will see the peak? The University of Hong Kong team said we are yet to see the peak, and next week and every day we will have 180,000 more cases. Is that in line with your estimation? Yesterday, it was said that we only need a few rounds of tests in the citywide universal testing, and it will not last many weeks. So do we have enough manpower for the free test? And about public morgues, according to healthcare staff, some public morgues or morgues in hospitals are full, and there are places in some hospitals like the Queen Mary Hospital. It is because of the logistics that the dead bodies are not transferred to these morgues with capacities. So will we have a solution for this? Now, today's number is similar to yesterday's, some 30,000 cases. It seems that the number has not risen further. A few days ago, we have announced that members of the public testing positive on rapid antigen tests would be treated as confirmed cases. No PCR test is required. So the number cannot fully reflect the reality. In the past 2 days, we have 30,000 cases for each day. If the level remains for the next week, or if the number rises any further, then we will have an accumulated number of more than 200,000 cases per week. So we will keep closely monitoring the situation. At present, we have received fewer numbers of PCR tests because members of the public are using RATs. We will roll out the online registration platform for RATs as soon as possible within this week. So members of the public who have done a self-RAT test can report to us, so we can have a better grasp of the actual situation in the community. About a citywide universal test, the chief executive has made an announcement yesterday on it. Currently, we are still at a preparatory stage. No specific date has been set yet. We will canvass views from the public, as well as listen to expert views on the details. However, we advise members of the public who think themselves to be at risk, or if you have come into contact with high-risk people, you should do a test as soon as possible, be it a RAT or PCR test, rather than waiting for the universal test. We want to identify each case as soon as possible for early identification, isolation, and treatment. For the issue of morgue, Dr. Lee, please. In hospitals, for patients who passed away in A and ED, the bodies would be kept in A and ED. For patients who passed away in hospital, they would be the bodies would be placed at the hospital's morgue. Now we have more patients deceased, so we are using the hospital morgues, and we have a system to monitor the capacity. So I don't think the situation you mentioned exists. The lady in black. I'm from Orange News. Now, the Funeral Parlours Association told us today that some funeral parlour practitioners have worries that they would get infected when they are dealing with dead bodies, and they are not trained in terms of PPEs. So would you update the guidelines for the funeral parlour trade? And yesterday, there was a video circulating online that a member of the public did a RAT in a restaurant, and the results was positive. Would you recommend that you advise members of the public to carry out a RAT in an open door setting with a 2-meter distance with other people? But would it increase the risk? And where is the best place to do a test. Now, has the situation in A&ED improved? And what is the bottleneck of transferring dead bodies? On the problem of a morgue or mortuary, I don't have the actual figure, but it is near our full capacity. For A&ED and hospitals, the mortuaries would work together to store the dead bodies. There is a difficulty. That is the lack of space in hospitals, and then the logistics issue, and then the lack of space in the public mortuary. And the situation has improved since yesterday. In terms of PPE, the CHP's infection control unit has been issuing and updating guidelines on infection control for different trades, including the funeral parlor trade. We have been communicating with the department of the FEHD and the trade. If there are any difficulties, our colleagues would offer recommendations to them. In terms of the situation of our mortuary, the Department of Health has been closely monitoring the situation. We have 3 public mortuary, and we have increased the number to 1,350 places, and we are using different means to increase the capacity. For example, the Department of Health has borrowed dead bodies storing place with the Universal Funeral Parlor House under the TWGH, and also 2 residential care homes have lent 40 places for our use. And also near the Sha Tin public mortuary, we will install a refrigerated container for storage of dead bodies. Thirdly, we will speed up construction of the Fushan public mortuary. Some 800 additional spaces will be available in early April in phases. We will closely work with the HA and the Department of and the FEHD to closely monitor the occupancy rates of public mortuary, and we will come up with emergency measures if needed. And we are aware that for some deceased COVID patients, their family members need to be isolated at home. Because they are isolated at home, they cannot go through the relative procedures to claim the bodies. We will closely work with the police. If family members of deceased patients are under isolation, then as an emergency measures, they would be allowed to go out to go through the procedures so as to speed up the claiming of bodies.
Next, that lady over there. I'm from the Phoenix TV. Now, we're still seeing a rising trend for cases. We're seeing more death cases each day. I understand the hospital authority is working very hard to treat serious patients. So far, in the 5th wave of the pandemic, what is the recovery rate and the discharge rate? Is there also a rising trend for that? Sorry, can you repeat your question? Now, so far, Dr. Lee just now mentioned that the number of people who have recovered and been discharged. So the discharge rate and the recovery rate, do you have any figures? Can we see improving trend? And Sorry. Well, for discharge rate, as you know, we have adjusted our discharge criteria so patients could be discharged earlier. The latest set of discharge criteria is that for those who've been vaccinated, and if their condition are deemed stable clinically, then they could be discharged. And then on the 6th and 7th day, they could take a rapid test, and then they don't need to be isolated at home anymore. And for those who have not been vaccinated, then on the 14th day, they have to do an IRAT. And then you see in the past period, we are seeing more patients being discharged every day, about 500 to 600 a day. The gentleman on the 4th row. I'm from AM 730. How many imported cases are there? Yesterday, Dr. Au mentioned that for those aged about 80, the overall death rate was 4.6%. But then for those who've not been vaccinated, the percentage is only 4.34. That means there are still many who've been fully vaccinated and still there were death cases. So how should we read the death rate and the vaccination rate? And some experts have said that any statistics on death figures won't be accurate before the epidemic is over. So what is your view on that? And then there are 2 patients that were transferred from Tin Shui Wai to Tuen Mun Hospital. Just now we were told Tin Shui Wai is a dedicated hospital for COVID patients. How come these 2 patients were transferred out of the Tin Shui Wai Hospital? And part of the new facility is a public mortuary facilities. What about the Kowloon public mortuary? Is it reopened? And what about the Fushan public mortuary? How many spaces could it offer? And then for the 2 residential care homes, is it some form of a lease arrangement? What is the rent, roughly? Sorry, I omitted to mention there are not 5 import cases. The rest are local cases. On the death rate, I announced some figures yesterday. Perhaps there are some discrepancies in the figures, so I will give you the figures again today. Among the death cases, we have analyzed 527 cases, and of the 527 death cases, the death of the 527 cases analyzed, the death rate is 0.29%. And of course, the percentage will continue to go up because some of the cases may have, seen the patient's condition getting worse and then passing away. Now, for death cases, they involve mostly the elderly, especially those aged above 80. And then of the 527 cases analyzed, 63.5% of the death cases involve elderly aged 80 or above. And then for those aged between 70 and 79, they accounted for 18.79%. And then we've checked whether the patients who passed away were vaccinated. For 428 of the cases, they did not have any vaccination at all. And then the death rate is 1.3% for this group. For those who have received 2 doses of vaccine, then the overall death rate is only 0.04%. And if we look at the elderly, then the distinction is even more obvious. For those aged 80 or above, patients who are deceased, the death rate is 4.5% for those without vaccine, who are not vaccinated. And for those who've had 2 doses of vaccine, the death rate is 0.91%. For patients aged 80 or above who've not been vaccinated, the death rate is 7.18%. So you can see is many times over that for those who've been vaccinated. And for those who've received 1 dose of vaccine and aged 80 or above, the death rate is 5.78%. For Fushan Public Mortuary, the Department of Health will speed up the construction of the new Fushan Public Mortuary, and that could provide 800 spaces. For the cold room in Fushan Public Mortuary, it can be completed in a few days and it can be put to use. I don't have the number of spaces that will be made available as a result. Tin Shui Wai Hospital, true, there were 2 cases. A 47-year-old female, she had a fever and she had heart blockage. And then another patient was a 57-year-old male. He had shortness of breath. For both cases, their fundamentals were not stable, and that's why they had to be sent to an acute hospital, and that's the criterion for the A&D.
So figures from CHP show that there are 220,000 cases in total in the 5th wave, but HKU Medicine said today that there are 1.7 million people infected in the 5th wave. So do you think CHP daily figures are seriously underreported? And more than 800 COVID patients have died at hospitals. So are there any cases in which people were found to have passed away at home and later found to have COVID? And about the mortuaries, are private mortuaries enough to relieve the burden on public mortuaries? Thank you.
Thank you for your question. For the number of confirmed cases, as you know, they refer to cases tested positive by RT-PCR. So these cases are confirmed to be COVID-19 cases and were reported to the Department of Health. Up to yesterday, we have over 220,000 cases recorded. However, we understand that COVID-19, many of the patients infected with COVID-19 cases, they might be asymptomatic or with very mild symptoms. So not all of them will get tested. So the figures we have captured refers to the positive tests, including asymptomatic and symptomatic patients. But however, in the community, we know that there might be a significant number of infected cases because they are either asymptomatic or have only very mild symptoms, so they do not get tested and will not captured by our figures. So I think that the figures is an estimation based on modeling by the University of Hong Kong.
Okay, according to our figures, I don't have exact figures whether the patients die at home or not. But for today figures about the young patients among the 6, they all come through the emergency department and under active treatments and pass away after they have certain degree of treatments in the hospital. But I would like to supplement about a case that we reported. We have a delayed report, which is the youngest one, the 57. The 57-year-old lady who found collapse at home with fevers, and also we find out she has the chest infection. She is an OH home resident, and she passed away while after resuscitations in the emergency department. And this is the only case I can recall of. The mortuary. Your questions again, sorry.
So are the use of private mortuaries enough to relieve the burden on public mortuaries?
Oh, I think according to the figures of Dr. Au, they trying the best, and other than the private, and also they try to speed up the new phases of the Fusan mortuary. See, any supplement from Dr.
The Department of Health has borrowed some spaces from the private sector, including the Tonghua group of hospitals. Up to a total of about 45 spaces will be lent to the Department of Health, and also we have lent about 40 spaces from 2 nursing homes.
係嗰邊第三行最出嗰位女士，黑色衫嘅。
Next question, the lady over there.
In the SCMP, so we're seeing less people in Penny's Bay over the past few days compared to before. Why is that the case, since it holds up to 4,000 people? Does this have anything to do with complaints received from people who have been stuck there? And do health authorities have a figure on how many elderly are kept at isolation facilities, and a breakdown at the different facilities if the information is available? Thank you.
I don't have any exact figures, but you're talking about the isolation facility. You mean the community one? The community facility in Penny Bay is around 570 patients, but all of these cases will be rather young patients. They won't be elderly, and all the elderly will be kept in the public hospital.
下一位嗰邊牛仔啦。
Next question, the lady in denim jacket.
I'm from Bloomberg News. My first question is about basically the mass testing that's to come. A lot of the public is speculating whether there's going to be a lockdown that's going to come with the mass testing. Can we have any information on that? And my second question is on COVID-0 again. We're seeing, the number of deaths rise in recent days in Hong Kong. And basically, the public health rationale for COVID-0 has always been to save lives. So given that we're seeing such a surge in deaths, how does the government plan to respond, and whether there is a rationale to stick to dynamic COVID-0? And my other question is just to clarify the number of deaths recorded in the hospital authority. So today we have 808 accumulated deaths within the hospital authority, and I think yesterday it was something like accumulated total of 841. So can I just check about these numbers? Thank you.
For the first question on compulsory universal testing, the government is still collecting views from experts and also from other sectors of the society to plan the actual details and also the operations of the testing program. So there is no confirmed details at this moment, but I think the government will consult the experts and to find out the best way to handle or to launch this program. But the most important thing is we advise people who are high risk group or who have any symptoms to get testing as soon as possible. They do not need to wait for the compulsory universal testing. If they are getting infected, the best strategy is to get the diagnosis and to be isolated at home. And right now, the government is still adopting the dynamic COVID-0 strategy. At the present moment, the epidemic is quite serious. So at the present stage, we aim at early detection of all the cases first, and to put them under isolation, and as well as put their household contacts under isolation, so as to stop the ongoing transmission of the disease. Coupled with a series of social distancing measures, we think that the number of cases will drop later in the subsequent months, after the number of cases has decreased to a certain number. When the number of cases drops, then we can adopt more aggressive strategies on contact tracing as well as compulsory testing, so as to increase early detections. And so this is our strategy at the moment.
Okay. About your figures, I have to verify, but all right. The figures of yesterday is 633. I think you've been mixed up about the figures of the 841, which is for the past 2 to 3 years. Okay. So yesterday is among the fifth wave. Yesterday is 636, and today is 808.
下一位呢邊後邊嗰位先。
Next question, Lady Patek. Hi, I'm from Ming Pao Daily. Dr. Au. Several experts advise that we should wait until April to do the universal test when the number is under control again. So what do you think about these this advice. And about the isolation facilities, we have received the complaints from the members of the public. They have made complaints to the Department of Health and the Fire Services departments that the household condition is not suitable for isolation, and then they were sent to hotels. So how do you decide who can go to hotel? If the household condition is suitable, but people are still sent to isolation facilities, is that a waste? And about a makeshift hospital, it is said that patients have to share bathrooms. So is there a risk for cross-infection, and is there a standard for the number of patients per toilet? And you have updated the guidelines that for those who have received 2 doses, if they are tested negative on a RAT on the 6th or 7th day, they can end the isolation themselves. So is this effective already? So if we have such patients who have passed the 6th or 7th day, say the 11th day, and they have tested negative, can they go out? Now for the Pfizer's and the other vaccines, the drugs, how many stock do we have? And have you procured more? And who will be given these 2 drugs? And you said a 58-year-old male with no underlying disease passed away on the 28th after admitted to Queen Elizabeth Hospital on the 27th. So why did his situation deteriorated so quickly? Was it a Delta strain? And you said a 57-year-old female passed away. Did she die at home or in hospital? So I will take your questions first. About the inventory of drugs, I don't have statistics yet. I will get back to you later. We have a guideline in terms of course of treatments, and we would consult experts from time to time. About the 58-year-old female, I mean a male, he sought medical treatment after some 10 days of illness. So I don't have any further detail for that case. For the 57-year-old female, she approached the Eastern Hospital's A&E department. She is a resident of a care home. She has a history of stroke and heart disease. Now we have a task group comprising our epidemiologists. They would have meetings and update the guidelines from time to time. About universal testing, the government is preparing for the citywide test. The purpose is to identify silent patients in the community swiftly and isolate them and provide treatments to them. The goal of universal community testing is to achieve 0 cases. We want to find all the invisible cases, isolate them, as well as their household members. About the timing, well, scientifically, we don't have a lot of experience like this globally. The goal is to find all the cases and isolate them. About timing, we need a lot of cooperation from many sides. The government is in full steam preparing for it. For the timing, I think the government will have in-depth discussions with many experts. We need the testing capacity to come with it, and also how we deal with the cases found. We need enough isolation facilities, and we have to have enough treatment facilities for the patients. So that's the consideration. About the household context of cases, who need to undergo isolation in community isolation facilities, there are several considerations. The goal is to send cases in the early stage to the community isolation facilities. We believe that their viral load would be higher in the initial 1 or 2 days, so they would be given priority to undergo isolation in community isolation facilities. In terms of household condition, if there are high-risk groups or immunocompromised people in the household, or when the home is small, then the infection risk would be high. Priority would be given to these cases to isolate in community isolation facilities. We have a serious shortage of spaces in these facilities, so not everyone will be assigned to check into the facilities. So we would decide who goes to community isolation facilities based on the criteria I mentioned. For cases who are not living in subdivided flats or so on, but if they are at an early stage of onset, we will also arrange for them to check into community isolation centers. The point is we would try to fill all the spaces in the community isolation facilities. Now, for the makeshift hospital in Chengyi, we have received advice from experts. Infection control regime has been put in place. The hospitals, the makeshift hospital takes in patients only, so there will not be a risk of cross-infection.
嗰個我都再想講一次啦。咁關於一啲
Yes, you can definitely repeat for positive cases. Now, on the 6th and 7th day, the RAT results are negative. That means the viral load is very low, or there may no longer be any viral load, and that means the patient has almost recovered, so he or she could leave home. But on the 6th or 7th day, the result is positive. Then on the 8th, 9th or 10th day, that person could continue to do RAT every day. If there are 2 consecutive negative test samples, that means the person has recovered and then he or she could leave home. It's the same for home contacts. We've started the arrangement, and this condition is included in the latest isolation orders. Now, of course, the primary condition is that 2 doses of vaccine have been taken. So if the condition is that if the person has had 2 doses of vaccine, and then on the 6th and 7th day there are 2 consecutive negative test results, then the isolation could be deemed to have been completed. I'm from cable TV. Just now, that's mentioned that 615 residential care homes have been affected. So what is the percentage out of all the residential care homes in Hong Kong? Second question for Dr. Lee. Are you going to use cold storage containers to store bodies? When will you have these storage facilities, and how many bodies could be kept? And there's mention of a 58-year-old male patient. Can I ask again, is it that you're not sure whether he had any underlying condition? So did he have or have not underlying condition? And there's mention of a website. So people could register if they test positive on RAT. So what is the progress with the setting of the website? When will it be available? If patients or if members of the public need medical certificate after testing positive, can they obtain the certificates through this website? And what if someone fakes positive test result? Would there be any penalty? And if I could ask the 2 doctors to clarify another point. Now, there are people who use the RAT and they pour water into it, and still they get 2 lines. So what is the reason for that? And what are the principles? And then And then online, the news circulating that some of the rapid antigen test kits were manufactured before the Omicron came about. So is it possible that these kits could not test for Omicron? Well, we have considered various options with storage of bodies, but we haven't got any decision, so I have nothing further to add. Now, for the 58-year-old male, he was admitted to the QE and ED on the 27th of February, and he passed away on the 28th, and he did not have any underlying condition. Now, for home cases involved, there are over 600. Either they have reported cases or there's an outbreak. And of these 600 plus homes, about 70% are homes for the elderly, and the remaining homes are those for persons with disabilities. And I think in Hong Kong, if you could consider the total number of homes in Hong Kong, then about 55% of the elderly homes have seen cases, and then about 45% of homes for the disabled have seen either infected cases or outbreaks. Now, this week we're going to launch a website for those who test positive with RAT at home, and they could go there to register their case. And it's not the same as with obtaining medical certificate. You would not encourage the public to use this website to obtain medical certificate, because that's not the purpose of the website. Is rather, if someone tests positive with ART, and then we will consider that as a confirmed case, and then we handle it accordingly. And we will send RAT kits and other information to the person, and then an isolation or quarantine order will be issued for the person, and home quarantine order will be issued for family members. And then we've seen cases that maybe someone has tested positive, and then we received the information to arrange for the person to be admitted to hospital. But of course, there are not enough facilities at hospital. The person may have waited at home for some time, and he may have recovered before he is admitted to hospital. For these cases, we will announce later how these people could obtain some sort of certification that they were confirmed, and prove that they had to be home isolated during that period. We'll make the announcement later on the arrangement. And if someone needs this kind of certification, they don't need to go into this website so as not to cause confusion. For RATs, well, yes, there's a news report that by pouring water in, there's a positive test result. Now, we would suggest to the public that if you use the RAT kits, you must follow the instructions printed on the kit. You know, that includes the sampling method, and every step of the way you have to follow that. Now, with this kits, there you need human samples for them to work. If you use other means to use a test kit, the result means nothing really, because with water or other liquid, it's possible that there is some sort of there's some elements in the liquid that could react with the test kit, but then it means nothing. So I hope the public will bear that in mind. And also, if you use the test kit, you must read the instructions carefully. You need to make sure that test kit complies with the necessary standards. And you could get the information from the Department of Health website. Now, I omitted to answer an earlier question. That is, if someone has anyone, what if people do an RAT at a restaurant? Well, we certainly would not advise that. RAT should be done on private premises without other people around, because and people have to observe personal hygiene, wash their hands, and so on. And then they should do it in a well-ventilated place and in on private premises. Please do not do RATs on at public premises, so as to avoid infecting others. And also, finally, can RATs test for Omicron? The Public Health Laboratory has done some tests with RATs available on the market for testing Omicron, and most of them work because our RATs contain antigens for virus, and for Omicron virus, our tests show that these test kits could test for this virus. Thank you.
The lady in a white jacket. I'm from Point News. We are told by members of the public that their family members and children at home are infected, but they are not able to buy proprietary medicines themselves. Now, it is a fact that many people have to isolate at home, but can the authority advise what members of the public can do in terms of medicine? Now, the government is going to requisition newly built public housing units for isolation purposes. So what other sites are the governments considering to convert into isolation facilities, and what's the progress? And what is our daily testing capacity in Hong Kong? For the additional capacity we have, is it because of the help from the mainland? For those undergoing home isolation, the FEHD and the Home Affairs departments are providing support to them. The patient himself has to stay home. We will see whether we have to check him into community isolation facilities. The household members need to undergo home isolation. We would deliver anti-epidemic pack to them with information pamphlets, thermometers, and RATs, and so on. The public should follow the instructions and perform tests themselves. When they are tested positive, they can call the HAD's hotline. And then the HAD colleagues would inform the Department of Health for follow-up actions. If any support is needed, you can also call the hotline of HAD. On isolation facilities, we are aware that the government is seeking sites suitable for building isolation facilities. The purpose is to put patients and close contacts under isolation to prevent further transmission. The lady over there, I'm from Hong Kong Economic Times. Now, the Ching-Yi community isolation facility is completed. So how many patients will be transferred from HA, and how many healthcare staff will be deployed? How many healthcare professionals from the mainland will be deployed there, and what will be the division of labor? They healthcare professionals from the mainland do not have to undergo registration in Hong Kong. So what about the liability issue? There is a rumor that the universal community test regime will come with a lockdown. Many people are in a panic. There is a rush to supermarkets. So can you clear the rumor about the 58-year-old male who passed away? How long has he waited in the A&ED? Was there a delay? Now, Omicron symptoms are very mild. So was his cause of death really COVID? Now, many people have been tested positive on RAT, but the website is not ready yet. So how can they get the certificates to take sick leave? And about the borrowing of private mortuary spaces, which two private institutions, and how much? Now, the makeshift hospital, the HA is responsible for the treatment station, and we don't have any news yet. About the 58-year-old male, he has no underlying disease. In the afternoon of the 27th, he went to the Queen Elizabeth Hospital's A&ED. A test was done, and his situation was bad. He was hospitalized, and he passed away at 7:22 a.m. the next day. Now, A&ED in hospitals are under huge pressure, but we will still provide help swiftly. I don't have information and statistics on that. On the issue of a lockdown, the chief executive has made an announcement yesterday. The specific details and the timing of the universal testing is still in a preparatory stage. Discussion is still ongoing, so we urge the public not to believe any rumors. And there is no need to rush for supplies. When the government has the details, the government will definitely announce it in good time and allow sufficient time for the public to prepare for it. So there is no need to panic. When the details are hammered out, the government will announce the details as soon as possible. On rapid test, since last week, we recognize positive test results on RAT. On our platform, which provides information for positive patients, we have received reports from some patients. We will launch a new platform for patients tested positive on RAT to provide us with the information and for confirming their identity. Currently, we don't have any confirmation for the identity of patients reporting positive. So when the platform is available, there will be a tracing procedure available, and we will trace the onset dates and issue and a quarantine order.
或者一陣間
I don't have the information at hand. Perhaps our press colleague could provide you with the information later. Sorry, speaker is not using microphone. Sorry, could you repeat your question? Sorry, the speaker is not using a microphone. We don't have the information for at the time being. I'm from Ta Kung Pao. Now, some may have been infected, and then they've been trying to make calls for 3 days. They couldn't get through, and they suffer a fever over 40 degrees Celsius. They went to designated clinics still. They couldn't get to see a doctor. So this sort of situation is not desirable. Is there any room for improvement? And how can you improve the situation so you could give hope to the people? Second question. Restriction testing declarations and cases identified through these operations. In the past few days, over 1,000 cases have been identified through our TDs. So have these people been sent to isolation facilities? On average, how long is the wait for them to be sent to isolation facilities? And then has the Center for Health Protection follow up on the condition of these patients? Third question, for the 58-year-old male, was he vaccinated? Thank you. Let me talk about the 58-year-old male patient first. He did not have any record of vaccination. Now, for confirmed patients waiting to be admitted to hospital, and then during the wait, there are symptoms develop, and so on. And if it's an emergency, of course, the best he should call for an ambulance. But if the conditions are mild and not serious, then we would advise the public to call the hotline of the Center for Health Protection or the hospital authority. I'm sure the hospital authority colleagues will provide support to them. if they need to go to designated clinics, hospital authority colleagues will make arrangement, I believe. Perhaps Dr. Lee could supplement in a moment. On cases detected through restriction testing declaration exercises. Since last week, we put in place an arrangement in a building. If positive cases are identified, because we would have just collected the samples, and maybe these samples test positive, and these are considered the newer cases with probably relatively lower viral load. If there are many cases in a building leading to vertical or horizontal transmission, or a high risk of such transmission, then we will make special arrangement. That is for positive cases detected through RTDs, we would arrange for them to go into isolation facilities, including hotels, as soon as possible. Hopefully then, the infected persons could be removed from the building as soon as possible to reduce the risk of further transmission in the building. And then for household contacts, we will also distribute RATs. And for other residents in the building, we will also distribute to them RATs kits so they could do the test in the next few days. Last question. Good afternoon. I'm from TVB. Now, for this website for registering RAT positive results, we've been waiting for some time. What sort of the technical issues have to be sorted out? That's why the website is not available yet. What if someone conducts an RAT test and the result is positive, and then during the wait, the result becomes negative again? So how do I prove that? Do I have to keep all the test cassettes? And another question is about compulsory universal testing. Now, some experts have said that it would be better to do the universal compulsory testing in April when there are fewer cases. Now, it's possible that you may identify a large number of cases in compulsory universal tests. And then before that, is there any chance that those who are still waiting for isolation facilities would be accommodated before you look for new cases? Otherwise, you will see a repeat of what's happening now. Many people are stuck in a community. And what is the 6P's view on lockdown? Now, if you compress the period, so there are 3 tests in a week, or prolong that period, which works better. And now for the Qingyi isolation facilities, you're not arranging for patients to go into there first, but who would get priority to go into the Qingyi facilities? Thank you. Now, for people who test positive with RAT, we would suggest that they stay at home. We will still consider them confirmed cases, and then their family members have to be isolated at home too. The platform is still being prepared. There are technical and other information technology colleagues are building the platform. We hope to launch it within this week as far as possible. And then after the platform is launched, people can then make registration. And when they make registration on the platform, we will ask them to tell us on what day they test positive. And then we will do the counting on the basis of that. Say if a person tests positive a few days ago, then they will still handle the case the same as other confirmed cases. That is, the person could still do another test on the 6th and 7th day, and if the test result is negative, that means the person's recovered. Especially for those who've been vaccinated, they will recover quickly, and the conditions are mild, so they're able to get rid of the virus from their body very soon. Now, of course, we will make an announcement as soon as we have further information on the platform. As for the universal compulsory testing, when should we do it? I've already given an answer earlier. It's hard to say when is the best time to do it. But if we look at the trend of the epidemic, it's actually rather unpredictable. We cannot really predict when it will peak or when it will stabilize and ease. So given the current situation, we want the public to be tested as far as possible. Now, if people don't feel well, they want to take a test, they can do it anytime. There's no need to wait for the universal compulsory test. And if people are infected, and if they know they have been infected, I hope that people will take actions to prevent the further transmission of the virus. Now, the government is stepping up our effort to build more community isolation facilities, because we do expect an increase in cases. And if there are more community isolation facilities, then we could arrange for more people to go into the isolation facilities, especially those with higher transmission risk. So there is no need to wait for the compulsory universal testing before we use these facilities. Once these facilities are ready, they can be put to use, because we know there is a large number of patients waiting to go into community isolation facilities. Now, you mentioned the Chengyi community isolation facilities. As I said earlier, I don't have any information at the moment, but then community isolation facility is something between the hospital and treatment facilities, and it's for patients with mild conditions. That's the end of press briefing. Thank you. Sorry, speaker's not using microphone. No, we don't have any decision yet.